Thank you everyone so much for joining us today at our Innovation Summit. With that keynote to center us and that incredible story as well, I know so many of us here on this call want to know how we can be involved, or in the words of Mr. Daniel Dawes, how we can stand with the marginalized until we erase the margins. My name is Caitlin Donovan, and I am the Senior Director of Outreach and Communications here at the Patient Advocate Foundation. I'm pleased to introduce you to our next panelists, all of whom are leaders within their communities and represent different ways of working for change from outside the system, within the system, or even from within the system. Joining me, I have Ms. Andrea Martinez-Mejia, Executive Director of the Greater Newark Healthcare Coalition and Secretary of the Board for the New Jersey Healthcare Quality Institute. She has served as the Chief of Staff for the New Jersey Department of Health, where she was a notable advocate for Spanish-speaking populations. Mr. Quinton Law is the New Jersey Government Relations Director for the American Cancer Society Cancer Action Network. He is also the mayor of Morristown, New Jersey, where he was elected first to council at the age of 23 and at 27 became the youngest acting mayor in the state. And finally, not from New Jersey, we have Dr. Brian Parks, who is not only a family medicine physician, but also the Director of Community Health Justice at the Oregon Health and Science University Health Equity Organization and the Director of the Relate Lab, whose mission is to co-create a more humanizing, equitable health system. Welcome, everyone, and thank you for joining us here. To start off, I would love everyone if we could go around and you can tell us all how you became active in your community and what you're doing. Brian, why don't you start?
Yeah, thank you, Caitlin. Thank you so much for having me. My name is Brian. The easy part of my job to share is that I'm a family medicine doctor in Portland, Oregon. I work at a community health center, and I also do some hospital medicine as well. And I like to joke, that's what my very Korean parents tell their very Korean friends is what I do for my work. The truth is, really what I get to do for my work I've actually come to describe as being almost like a hospice nurse, not for patients, mind you, but a hospice nurse for the healthcare system. I think many of us in this room can agree that there's a lot about the American healthcare system right now that does not work for a lot of folks and a lot of communities. And so I'm really fascinated by what are the parts of the healthcare system that we can help just atrophy and decay off and how can we all have the courage to try to reimagine different ways of healing and promoting health equity within the healthcare system? So a lot of the work that I get to do, you'll get to hear about, is doing clinic-based community organizing, where we really start with listening to systemically harmed community members and building collective action campaigns together. So you all just got to hear from Lisa Roach, who's one of our awesome community leaders who's working with us on a campaign where we will be launching the first re-entry clinic for folks returning home from carceral facilities in Oregon. So that will be the first medical home of its kind in our state. And yeah, I also get to be the medical director of OHSU Health Equity, where we build community-powered health programs that advance health justice as well. So deeply grateful for the work I get to do. I often have to pinch myself and feel like I'm not dreaming, but just to be in that reimagination space is really powerful. I feel extremely humbled and privileged to be able to work in collaboration and partnership with community members who are already leading this change and are experts of their own world.
Thank you. And Andrea.
Hi, good afternoon, everybody. As Caitlin mentioned, I have spent over 20 years in working for state and local government, and where I have seen how policies I've made and how they impact our community. What has bringing me to the public health, to the to working in the health space, has been the ability to really have some direct influence in terms of what's happening around the health of our communities. I have spent a lot of time also working with groups, particularly around women issues and communities of color. including our Latino community here in the state of New Jersey, making sure the information comes to them, making the information that we bring those leaders at the table, the community needs to the table, and working with the policy and decision makers on making sure that we're taking into account the health impact of those decisions. So it's a work, like as Brian mentioned, is really rewarding just to see and then to hear from the communities, the experts, and bringing that expertise to the table and ensuring that we are trying to build a health equity one day at a time.
And Quinton, please.
Good afternoon, everyone. Thank you for having me. My name's Quinton Law. I'm coming from Morristown in New Jersey. That's Morristown with two O's, not two R's. But I'm also the government relations director for the American Cancer Society Cancer Action Network here in New Jersey. And as someone that grew up in a community with teen parents, I grew up in New Jersey Family Care, which is the Medicaid program here in the state of New Jersey, and quickly learned through my own struggles, but advocacy journey, that the only way I was going to get a quality of care that myself and my family deemed adequate was if I advocated for myself. So as a young person, I was constantly that dealt with health issues at an early age. I was constantly in that position of trying to advocate for more access to care. And then I had decided to dedicate my life to public service and trying to fix these systems. I do believe that they can be fixed, but it requires a lot of work and a lot of love. So I've worked in government my whole career, but I joined the American Cancer Society Cancer Action Network about 3 years ago. So any bill that comes up in the State House that has to do with health equity, cancer, medical debt, we are looking at Medicaid, Medicare. We have our voice in the conversation to make sure that those that are fighting cancer are represented and heard. And that way we can build a more fair and just system for all of us in New Jersey. But yeah, that's a little bit about me. I'm also the mayor of Morristown. I have town hall right behind me. And I'm grateful to be in this position. I've been on council for 6 years, and I ran for office to do the same thing just in my community.
That's a really good example of how lived experience is informing what we're doing as advocates and how we approach our communities. And Brian, I know you mentioned co-creation is really important. Could you all talk a little bit about what it means to co-create with the communities you serve?
Yeah, I'm glad to start. I'm a very reluctant healthcare worker in a lot of ways. I grew up under immigrant parents, and growing up, I was always told by my parents that I could grow up to become one of three things. You probably know what they are. They said, Brian, when you grow up, you can be a doctor, a physician, or an MD. And they said, take your pick. Any of those three things will do. And I resisted that. And the reason for that is that my older sister, who's 3 years older than myself, was diagnosed with a really serious medical condition growing up. And that meant that my immigrant family, we had to interface with the healthcare system all the time. And this institution of healthcare that I thought was about healing and well-being, I quickly learned was not always that. It quickly became a place of othering, especially for my parents, for whom English was a learned language. And culturally, there were a lot of differences. And I think the quintessential thing that I saw about our healthcare system that persists into today is that we are really obsessed with being medically and technically right, but we often get it relationally wrong. So I think about that a lot, being part of a system that's always about being technically right, but not always about relationally getting it right. And I think what often gets missing, especially in health equity efforts, is that we elevate professional expertise so much, but we often do that at the sacrifice of elevating lived expertise. And I think that's why we have such a dysfunctional healthcare system right now, is that we continue to try to, do all these very evidence-based, p-value driven kind of changes. And I'm not trying to put those things down. They're important, but they shouldn't come at the expense of elevating the lived expertise of folks who have direct firsthand experience of systemic harm. And I say that knowing that if my family had an opportunity to share about their own experiences or about the immense assets of their own Korean culture, I think we would have had a very different experience in healthcare. So everything that drives me about my work is how do we create spaces within our healthcare system where we can really do exactly that, center and amplify the stories of folks who are systemically harmed. So we have worked on campaigns, 2014-15, folks who experienced houselessness and passed a local bill here that raised an additional $67 million for affordable housing in Portland. And then 2018 to 20, we worked on a statewide campaign that mandates that medication labels be translated to 14 non-English languages, which is to this day the most inclusive bill of its kind. And then you already got to hear from Alicia Roach and my mention earlier of launching the first medical home for folks returning home from carceral settings in Oregon. So all of that has been for and by folks who have that direct lived expertise. And I shared about my story of growing up under immigrant parents and having language barriers. That language access bill of medication label translations, that came about because I did a one-to-one with the adult child of an immigrant family. They lived in a multi-generational home, and I did a one-to-one relational meeting with them. And they were coming in between jobs and shifts, and she always did her mom's pill boxes. Her mom spoke primarily Spanish. And she held up a pill bottle to me and said, "Brian, can you read what this label says?" I said, "Yeah, of course. It says take once a day." She said, "Well, Brian, yeah, it says once a day to you. Do you know what it says to my mom, who speaks primarily Spanish?" And I said, "No." She said, "It says once. That's 11. So she thinks she has to take this pill 11 times a day." So that was a perfect example to me that even though I had that lived experience, I've been so socialized into the American healthcare system that my professional expertise brain had kind of taken over. And that moment of lived experience and lived expertise completely popped my reality wide open. And that's how that campaign started. And that adult leader became one of the main leaders of our campaign. So just the work that we do is just peppered with moments like that of lived experience, absolutely just puncturing kind of the social conditioning of what I think is professional expertise. And really what we try to aim for is how do we make those two things come together, have the professional and technical expertise, but also have the lived experience drive the campaigns that we have.
So Quinton, when you're hearing a story like that, say in ACS Can, how are you transitioning that type of story into action?
Yeah, so it's a great question. One thing at ACS Can that we always try to do is lead with the patient voice. And that's because I see my job as a government relations director to take these stories, take the information from the researchers, the patients, the providers, and put it in a language that our decision makers, legislators in the state house can really understand. And what I found is through my experience, I can bring all the facts in the world. ACS does an annual cancer facts and figures study that we put out every year that projects what the cancer rates are going to be in deaths, unfortunately, in every state in America. And I can put that in front of a legislator. And in New Jersey, where we have the highest prostate cancer incidence rate in the country, I can put those facts in front of someone and they'll read it and they'll say, "Okay, thank you. I agree. No one supports people getting sick and dying of cancer." But it's not until I brought a volunteer that actually dealt with getting a PSA exam and finding out that they had an advanced stage of prostate cancer, but there were no symptoms, and they're crediting that exam for saving their lives. Did the legislator understand the importance of screening? And that's just how human beings can be, right? We understand it a little bit more when we're not reading it on a piece of paper, but when we're talking to another person that's been through it and understanding their perspective. So for me, when I hear those stories, and there's volunteers that are willing to share them, I make sure that we put it in a form where it connects the facts and the figures that we're presenting and showing those that are making these decisions how important it is that we expand access to screening, that we invest into cancer research, that we expand access to care generally, because those outcomes are undeniable. And what we know in the cancer space is if we do invest in screening and early detection, ultimately the cost of healthcare will go down over time because it costs more to treat someone with a more advanced stage of cancer. So for me, I'm focused on, these healthcare costs are skyrocketing. I see it every day in my role as mayor of Morristown. It's one of our most expensive things in the budget. I want to make sure that we start making tangible investments into the things that lower cost over time.
Andrea, I had a different question, but I really want to ask you this. And listening to what Quinton and Brian have said, and coming from the Department of Health, um, what, how did you feel when you would have people come in telling these stories, like with the power that you had to make a difference, but the lack of power to like wave a wand and change all of Medicaid law in the state? Like, what was that experience like, and how do you bring that into creating change?
Sure, thank you, Caitlin. As you said, it's very difficult sometimes because we, certainly have, and now some of these laws in terms of health are made up not only at the state level, but also made at the federal level. Like in the case of Medicaid, a lot of the guidance is coming from the federal level. So having to break the balance between those two is very difficult sometimes. And I always, oftentimes, I tell people, the majority of the folks that you find in these state agencies, and that's something, working with the Department of Health, I found the majority of the employees there like really passionate about public health, really passionate about doing the good job and trying to keep people healthy, as we saw during the pandemic. But yeah, sometimes it is hard to change laws, and as what our keynote speaker mentioned, right? It's like we have the social determinants of health. We all understand that we want to do something about it, but then it's a political determinants of health, right? And these departments, these agencies are at the federal, state, or local level. There is the politics played a big role in diverting some of those that work that's happening, and different folks advocating for different things and different changes. So sometimes it makes it very difficult. One of the things that we did. And trying to change some of that or turning the tide, I will say particularly around during the pandemic, especially, I was understanding some of the experiences of the people and the hesitation, especially when we came to around vaccination, and then utilizing community as trusted partners. One of the things that we found that is so important is just to find those trusted partners in the community, as Brian had mentioned, that they bring not only the life experience, but also they can be your advocate, they can be your mouthpieces in the community to help you bring the message. Sometimes the message is not well received by government, and rightfully so. We know, we all have stories probably into how at some point you have felt left out or feel that otherness that Brian mentioned, but having that connection with those and bringing and engaging those trusted community partners into the work that we do, sometimes it breaks, it helps you, it breaks that tension, and then it allows you to reach to the community and get some of the work that you need to be done. In a way that it got some more positive results, but there's definitely, as I mentioned, there's definitely a tension, and it is takes into a lot of the decision maker, the policymakers, folks that with so important also that our workforce reflects the communities that we're serving, because we bring the experience into the work, and then we know how to try to navigate some of those complex situations that we have, right? They're things that we cannot control, but like understanding and finding innovative solutions within that system is also important.
It's really, I'm thinking about how during the keynote, Daniel Dawes said that when people cannot participate politically, their health follows. So, what you were all talking about, and in the context of today, right now, a lot of people feel powerless and quite rightly also disenfranchised. So how do you see all of your roles in empowering people? Quinton, why don't you start with this one?
Yeah, so the first thing I would say is we're not going to change Medicaid by tomorrow. We're not going to change the system by next week or next year, but we can't let our inability to do everything stop us from doing something, right? We have to do something. And it's those culminations of those little wins across the state and across the country that actually create the change that we're seeking. So I would lead with that. But as far as, the folks that can feel powerless or how I see empowering others, especially here at ACS Can, is we lead with that first point that we can't let our inability to do everything stop us from trying to solve these systems. And then also say, you know, sometimes I talk to folks and they say, oh, like they talk about power like it's an ugly word. I really challenge that frame of thinking because power is really the only way we can change some of these systems. We're going to need to build coalitions. We're going to need those relationships. We're going to need to understand how the resources are distributed. These are all the pillars of those political determinants of health that the keynotes was mentioning. So for me, I try to remind folks that we need power to make the change that we want to see in our world. And the way we do that is we build relationships. We understand these systems because once we understand them, we're able to navigate them with less friction and able to ultimately be more effective. So I always try to remind folks that power building, especially in advocacy, is essential. And we shouldn't posture like we're not looking to, build our own our collective power to advocate for the cause that we're looking to address. Excuse me.
See a lot of enthusiastic nods. Brian, what do you think?
Yeah, I'm nodding vigorously because I know I found my people when we talk about power. And I totally agree with what Quinton has shared. I often joke power has somehow become a four-letter word. And I get it because the way that power tends to show up in our society is in a lot of what we call power over ways, right? This really falsely hierarchical transactional way that can be very, very zero sum in our world. And it feels really bad and oppressive to be in that kind of power. So folks what happens then is we become isolated, we feel disempowered. And the tricky thing about power is exactly what Quinton said. We need power for change. But what we try to invite people to do in the work we do at Relate Lab is it's not about just being power over, it's about building power with. And that's a very different kind of power. That's the power of relationships, the power in neighborly love. It's the power of solidarity, right? I grew up in Minnesota. That's exactly what happened earlier this year in Minnesota was that across many, many decades, all these cross-faith, intergenerational, cross-cultural coalitions had built these durable relationships that they were ready to deploy at this moment of extreme crisis. And so I think this shifting from power over to power with is a really important muscle that we have to build in this moment. And so we can't be afraid of that sort of power, but it does mean that we have to exercise a very different way of being in relationship, durable relationship, building trust with one another, and then moving at the speed of trust as well. So I just feel like we unpacking power, especially in this moment right now, helps us be really nuanced about our approach. Dr. John A. Powell, who founded the Othering and Belonging Institute, just wrote about, unpacking this myth that organized money always beats organized people. And he made it clear, organized money always beats poorly organized people. So let's organize well, right? I think we see bright spots of this all across the country, Minnesota being a very recent example of this. So let's really focus on organizing each other well, building very durable coalitions. And I think that's really the pathway forward, especially in this moment of time.
That's incredible. Andrea, what do you think? What are you seeing in Newark that is inspiring you or transitioning people from being reactive to proactive?
Well, I think a lot of what we're saying is what we said. We're facing a difficult, challenging moment, and especially I will say for in the nonprofit sector, a lot of the we have lost funding. We are seeing a lot of services being diminished. But what it has really created is a collaboration, a way for all the different groups to come in together and identify how we're going to survive, right? And at the end of the day, we want to make sure that our communities are being taken care of, and that we have recognizing that we have the ability to bring people together, and then that we can be creative. So what we're seeing is in a moment that it sounds even very you could be very pessimistic about it, but you're seeing is a lot of innovation, a lot of willingness to collaborate, so that we can maximize the resources that we have and bringing it to the community and keeping the community at the center of that decision making. And that I think is very important. It's a moment that we have to, when we look at the statistics and the data, and Dr. Downs brought up, there's just, it's just bad. Like if we don't take a turn into the right direction, the outlook for our healthcare system is very grim, and that's what like the building those coalitions and what Brian mentioned is really true in terms of the trust, and that is very important because unfortunately, institutions have broken the trust of our communities for a long time. So building that trust, it's important, and you have to regain some of that trust, and it takes some time and those relationships. So, but we're seeing that now, like desperate time have really bring people together with innovation and creativity, and now what we're seeing is a new wave of collaboration on how we are going to be not only surviving but thriving together.
A new wave of collaboration. That's so interesting. So, Andrea, when you say that, and you're thinking about it, when someone's coming to you and they want to make those tangible, meaningful steps that Mr. Dawes mentioned, what's step 1 and 2 there when they're asking you how to get involved?
So I think we said we can start small, right? Because these are some big issues. So a lot of it, I think, first of all, is just educating yourself and maybe educating your neighbor about what's happening. So let's take Medicaid, right? It's a big one, and we know that right now a lot of folks are either not understanding because it's very complex what's happening. It seems foreign. It seems very difficult. But it starts with like you picking an issue, understanding, getting some more information, being in forums like this, and then just talking to someone else or talking to a group or engaging with some folks that in your community and see how we can come together. So a lot of it starts in very small steps. It's like just learning what's happening. It's even what Daniel mentioned, like following the budget, following where's the money. We all live in our communities and we all talk about like politics are local. So understanding if you're a taxpayer, where's that money going? How is that being utilized? And then asking some other questions. How is this going to be the health impact of these decisions? Because that usually, unfortunately, we fail to do, as decision maker, policymakers, is like, well, how is this going to impact the health of the community? And it starts on that. And then 2 is just engaging with different groups. And some of them is just being, it's just participating even at the local level, going into some meeting. People don't want to go to like council meetings, or they don't want to go to the planning board. But a lot of those decisions that are affecting your health are happening there. Sometimes under, they're open public meetings, but nobody's there. So it can start small. You don't have to be big. You don't have to join a big national campaign. It can start by you learning what's happening, educating others around it, and then just building a coalition that can move the issue forward and connecting, building those relationships with all the other groups that are around you that are doing, fighting the similar fight.
Oh, you said council meeting, so I have to turn over to Mayor Law here. What about you? What do you think? Are you encouraging people to run for office still in this day and age?
Yeah, I think one of the most important things is, and I think Andrea hit the nail on the head with half of the battle showing up and understanding that being in the room is so important, because sometimes those are where these conversations are happening. And as mayor, I mean, I joke like there's usually in every town or city there's 1 or 2 retired individuals that have a lot of say in how things go because they just show up to every meeting. And that in turn makes them one of the most powerful people in town because they have a say on every single issue. Excuse my background if you can hear that. Um, but just showing up, being in the room. But when I first got in office 6 years ago, which I can't believe I'm saying, I had a bunch of ideas of what I wanted to do to make changes in my community. But what I realized is that government moves slow, and you need a whole lot of patience and persistence, and to continue to push the system and move those gears of government, and that's what will yield change. But sometimes we get frustrated, right? Sometimes it just seems like, I've gone to the council meeting, I've asked the questions, I did my testimony, and no one said anything back to me. That's when the persistence comes in. And it's like, no, I got to go back. We're going to send another email until we get that response, until we get that meeting. That's what makes it so important. And honestly, that's what some state legislators or some folks are counting on you to do. They're counting on you to let it go because it's just too much in your life. It's too busy. But that patience and persistence is so important. And then once you get that one, once you get that one legislative win, and that's why I love working for in the healthcare space, and someone that I was personally affected as someone that grew up on Medicaid, but I honestly get a lot of fulfillment out of meeting with these insurance companies and convincing them through the state legislature to cover people and to give them the care that they deserve. And when you get one of those legislative victories or the local victory, I've seen so many people that aren't, this is the first time that they've advocated for anything. And there's just a light in their eye because they believe again. And there's so much apathy. There's so much just like, I mean, I see it every single day. People that turn on the news, even, I mean, I feel the same way. Sometimes I turn on my TV, I'm like, what the heck is going on in our world? But it's the people and those that are fighting and still believe that these systems can serve us, that really give hope. So that's what I've seen, and I try to hold on to those moments and then identify those people so we can create more champions for the issues that we're working on.
Well said. And Brian, I know that you're going back, so I guess my question to you is not only what keeps you going back, but what is inspiring you? What do you think about all of this?
Yeah, I'm deeply inspired by people like my fellow panelists right now who are continuing to lean in this moment. I'm not so awash in the work that I do that I don't see how hard times are right now. I'm a parent to a 6-year-old kiddo, and there's not a day that goes by that I don't feel some sort of mini panic about what the world will be like when he is my age. Like these are very hard times right now, and they're projecting to be really hard times in the future. And a lot of what gives me hope is I see the bright spots. They're happening in small places. It might not be happening on a national scale, or it might not be spread in my world all across the US healthcare system, but there are people who are doing this bright spot work, and it's making a huge impact. And I think we have to build these networks where we can learn from one another, inspire one another, do these kind of innovative best practices. And so much of the last 2 years for me in these really unthinkably hard times, I've really reframed into thinking, how do I be a better ancestor? Like, how do I leave this healthcare system better for my children and my children's children than I found it? And I think that way about the world. How do we leave this world a little bit better than how we found it? And that's not to say that I don't feel the fierce urgency of now. There are people who are heartbreakingly being families that are being torn apart right now. So we have to feel that and act upon that. And I always am also taking the long arc of things of how do I show up as a better ancestor? What are the decisions and the actions I take now and with others right now that make me be proud of the world I'm leaving behind?
An incredible thought. I don't even want to add to that. I know we have a lot of questions in the chat, so I am going to hand it over to Jamie, who will relay some questions to you. Thank you, all three of you, so much for all of your words and for all of your work.
All right. Yes, this was a very active chat. We do have a couple of questions that have come in. The first one from Mallory Frazier asks, how do we as advocates promote political support for the least of us in the current political atmosphere where decisions are being made and executed unilaterally by the executive branch? Even when the Justice Department turns over such decisions and changes, the damage is often already done.
Well, I'll tackle that one. What I'll say is, I know it feels like, in this point in time that so many things are happening unilaterally from the executive branch. And certainly those things are very true. A lot of those are being fought out in court and turned over after the fact. So I think that a lot of that isn't covered. But as a mayor locally, this is something that comes up all the time where people are like, well, what can we do? I would say the best thing that you can do is focus on the government closest to you, right? Your local government, your state governments, they can make changes and do things that can codify and legislate and regulate some of the things that the federal government is choosing to do or not to do. So for me, I feel like this question, there's probably like 10 different issue areas that we can kind of dive down on this specifically. But for the sake of the conversation, I'll say, this, your local government is probably the most connected, it has the most direct impact on your life. Your state government can push back on actions that are coming from Washington, whether it's through lawsuits or legislative action. My recommendation would be to understand the issue that you're worried about, and then try to inspect, okay, what is happening in my state around that specific issue. Then go to, who is my local state representative? Understand who they are, know them by their name, and then that can help you then look into the policies. If it was me, I would then look at the legislation that's being discussed in the state house around that issue, and then talk to my state legislator about how they feel about that piece of legislation, and if they support it, or if there's a piece that I would like them to support. And usually it's your state legislators or their staff should be pretty accessible to meet, or at least hop on a call. So that's where I would start. But I tried to take your kind of big question and bring it down to the micro level a little bit. I hope that that's helpful.
Thank you. For sure. We had one more in the chat from Marissa Taylor. I think it's also important to acknowledge that some people don't have the ability to be physically present. How can we make sure their voices are amplified?
I think that that's important, and I utilizing technology. It's a good way to use technology, and now we have different ways to communication. So there is email that you can send, and what Quinton said, really, that information is easily accessible about who's your local elected officials, your state local, even your congressional delegation, and then sending an email, letting them know, calling, asking for like a Zoom call. It's another way to be in the present. Sometimes we tend to think that we need to be at the council meeting, and we want to see that as well. But like utilizing technology and making sure we're having those maybe one-on-one conversations, or like a group of folks requesting a meeting, and expressing their concern also is a good way to engage. So it's different. I think it's different approaches, different ways of going around it, and it's different strategies that are going to work for you. So some of them is, yes, we want to see those rooms packed with people supporting an issue, or advocating for good policy, but also those one-on-ones or the smaller meetings, those phone calls, those emails, just letting them know that how you feel about. It's also a way to get your information, a way to get it to them if you're not able to be present.
And I'll just say, if I can, everybody's got a role in advocacy, right? Like, and that's why the collective is so important. And building collective power around your issue is so important. You can fight these battles alone, but you're not going to be able to make it to everything. So just remember that as you go and continue to build your own power around your cause.
Wonderful. Thank you, Quinton. Thank you, Andrea and Brian. That conversation gave us something specific to hold on to, what civic engagement actually looks like when it's grounded in a community, in a state house, and in a coalition.